Drawn because of not toxicity, but infection, is effective, very effective in psoriasis and can have an impact on the arthritis. And alpha-septa, a related agent working through the same mechanism, is undergoing studies, is known to be effective in the treatment of psoriasis, and probably has a role in the management of psoriatic arthritis. But for the present, we're blessed in having a range of anti-TNF alpha preparations which
dermatology since its inception has been coming to Pakistan almost every year to attend our annual meetings. We really put our hands together. So I really appreciate on myself and on behalf of Pakistan Society for Rheumatology his efforts. I would request now Professor Shoaib Shafi to please come on the stage and give his concluding remarks.
I appreciate and I'm grateful to the Pakistan Rheumatology Society for having invited me. And as you know, I've been fairly instrumental in establishing the specialty of rheumatology, and all the rheumatology colleagues who are sitting here, they have worked all very hard in making this thing a reality by establishing FCPS in rheumatology since last 1.5 years, I suppose. And I appreciate all the rheumatologists of the country. Especially, I've been working together with Dr. Professor Abid Farooqi, Javed Niganveer, and Wajahat Aziz, and all other senior people interested in this specialty. And it has always been my desire and my dream to see rheumatology progress in Pakistan. And because I, as a physician and more special interest in gastroenterology, when I used to see a lot of people being given steroids by our colleagues, and they were presenting with different type of, problems in general medical practice, and the overuse of steroid really, it used to give me a lot of pain. And so I thought that the specialty of rheumatology, if it is properly established in Pakistan and people come up with this specialty, and the people which you will be producing, they will be much better physicians in dealing with all the joint and musculoskeletal problems. And so there will be some judicious use of steroids, not overuse of steroids. We also use steroids in gastroenterology, especially in patients when we are dealing with ulcerative colitis and Crohn's disease. But if we have some background of this basic knowledge, we can still actually prevent disease like osteoporosis and all the disease which you have told, and the side effects like Cushing. So, and I'd like to give some brief comments about the lectures. They were very informative for me also, and I listened them with fairly open mind. And I would just like to share with you some of my experiences, like about the age of osteoarthritis was told to be 40. So when I was 40, one of my friends who was an orthopedic surgeon from Lahore, and he came there and he said that you have got osteoarthritis of the knee joint, and that is, I'm talking about from 96. So he said that you climb these Marla hills and that's why you are developing osteoarthritis, and in few years, Shoaib, I'll be changing and your knees. And I pray for him. That was just by chance that after a few years he died. He's an orthopedic surgeon. He was from Lahore, and that is just that what we can't say anything. But I've still climbed Marla hills, and I think osteoarthritis is still continuing. So this is about 13 years from now. So he had diagnosed that I am suffering from osteoarthritis of the knee joints. Anyway, the other thing about osteoporosis. Similarly, in few years back, one of my class fellows, he was an Air Force officer, and he was diagnosed as male osteoporosis when we were 47 years of age. And he came to my clinic, and the scene was really very pathetic. On one side was his